Hey folks, this is Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, coming to you again this week with a brand new video. This video this week is called What You Should Expect on Your First Visit to a Chiropractor. As with so many questions of chiropractors, what you should expect on your first visit to a chiropractor, it's going to vary from chiropractic office to chiropractic office. Unfortunately, the chiropractic profession is not as standardized as many of us would hope it to be. And what does standardized mean exactly? Well, let's put it this way. If we compare it to the medical profession, if you develop an ear infection, you have a fairly good idea or expectation of what kind of treatment you're going to get, whether you're in Los Angeles, New York, Dallas, or Wyoming. The medical profession has a bit of a level of standard care and what you can expect. The chiropractic profession, on the other hand, can be a bit like the Wild West. Yes, we have governing boards, we have rules, and we have regulations. But as far as telling chiropractors how to run their offices, we don't have that level of standardization in our profession. For some, that's a great thing. Some patients really like the fact that there's a different type of chiropractor for all different types of patients. For certain types of chiropractors like me, the lack of standardization is frustrating, to say the least. I think that patients should know what to expect when they go to a new chiropractor, and as of right now, that just isn't the case. For this reason, I really can only speak to what one should expect on a first visit to my clinic here in Amarillo, Texas, because I can't really tell you about others. Being an evidence-based, patient-centered chiropractic office like we are, we're most interested in the quick resolution of the patient's pain at the least cost to them and the least amount of hassle to them. For that reason, we follow the most up-to-date best practice guidelines. I'm a bit of a research nerd, and I really like rules and regulations and following them. So let's get to it. A first visit here starts with the unpleasant task of filling out paperwork. Now, everybody hates this. It's everyone's least favorite part of a visit to a clinic. We do offer, however, the option of filling the paperwork out online in the comfort of your own home. So we try to take some of the sting out. Most new patients really prefer filling it out at home online rather than sitting in the office filling out paperwork. Now, once we review the initial paperwork, a staff member will take new patients back and begin an intake on them. They will ask questions about their health history, previous surgeries, previous treatments attempted, where it hurts, what makes it worse, what makes it better, and on and on and on and on. Following the intake portion of the appointment, I meet with the staff member that did the intake, and we discuss the case and what they found out so far and kind of what they're thinking. And by the time I enter the room to meet the new patient, many times I already have a pretty good idea of what may be causing the issue. And then I go to work testing my thought process to try to determine exactly the cause of the pain. We follow, like I said, we follow guidelines. And one of the guidelines that we really follow is put forth by the American Chiropractic Association through a program called Choosing Wisely. One of the guidelines suggests only performing x-rays when there are certain and very specific reasons to do so. Such as they got hurt in a car wreck, there was a traumatic onset of the pain. That's a red flag. And in choosing wisely, a red flag means go get x-rays. But lots of times there's no red flags present in a case. In fact, most times there are no red flags. So as a result, we only require x-rays in maybe 5 to 10% of our new patients. We don't even have an x-ray machine in our office for this reason. We would hardly ever need to use it. So at this point, I want to pause a moment just to describe what I feel really sets us apart from many of the others in my profession. Only about 2% of chiropractors further their education beyond their graduation with fellowship training. And I achieved my fellowship in orthopedics or neuromusculoskeletal medicine in 2019, so just last year. I became the only chiropractor to do so in Texas west of the I-35 corridor, and that's a lot of land, okay? This allows me to really focus in on the source of pain and come to a robust and more accurate diagnosis, and usually do it quicker than a lot of others. When you have the right diagnosis, you can tailor the exercise and the treatment regimen to the patient's specific case. And this gives us a better chance at complete resolution and gives our clinic a record of high patient satisfaction. Now, once a diagnosis is decided on, we talk about it. We talk about why it impacts you when you do certain things. Some of the things that you can do during your day to prevent triggering the pain, and things like that. After I've answered all of the patient's questions, when appropriate, we move to a treatment room where I adjust the patient and get good, healthy motion into the right areas. Now, after that, we move to the exercise rehabilitation room or the therapy room. It just depends on the patient and the needs. Since not everyone is the same with the same sort of pain or the same level of pain, the treatment is different and specific to each patient as well. For some, they can only tolerate very passive therapy like cold laser or electric stim or maybe some ultrasound. For others, they're able to be much more active. And in that case, we may move straight into the exercise room and do exercises or rehabilitation to support and strengthen the areas in question. Now, chiropractic is not 100 miles an hour or nothing at all. There's a lot of middle ground there. Some patients come in on walkers or even wheelchairs, unable to function hardly at all, while others just hopped in from the gym on their way home. So chiropractic care can be tailored to the patient's very specific needs, to their very specific abilities, and to their level of tolerance. And it's important to note that research is real clear on this. There's a good effect from spinal manipulative therapy or a chiropractic adjustment. There is good effect of exercises and strengthening and supportive regimens. But the best effect is when you combine the two. So we combine the two because, as mentioned, we want the pain gone as quickly as possible with the least cost necessary. And through exercise, we are also teaching the patient to be able to self-manage the potential reoccurrences of pain from their home rather than depending on us or any other healthcare practitioner for any sort of long-term treatment. People like me need to be teaching patients to self-manage at home, right? A normal patient should not typically need to see a chiropractor 40 to 70 times in a year. The normal recommendation from me for a new patient is just an initial trial period of treatment for like 3 visits per week for 2 weeks. At the end of a trial period like that, 2 weeks, well, we know quite a bit more about the condition, the patient, the pain, and the patient's ability to recover. And we can make any further recommendations from there. Now, chronic pain, as a general rule, just common sense, it's been there longer, it takes more time and effort to resolve. Chronic pain patients can expect more treatment recommendations. It's just a fact. Acute pain is less difficult and typically takes less time and less treatment. And as far as what to expect after a first visit to see us, well, the vast majority of new patients to our clinic experience relief. Of course, some don't, if I'm being honest. Some may actually get a little bit sore, kind of like they went to the gym to work out for the first time in a long time. Very few patients experience that, but I like to be honest, some do. And unfortunately, that's just unavoidable. Doesn't mean we did anything wrong, just means they got a little bit sore. But fortunately, the vast majority only experience a level of relief. Now, the first visit, honestly, it's a bit of a trust-building visit. The patient arrives with plenty of fear usually, some anxiety, maybe some uncertainty, and they really need to understand that we're really here to help them feel better, not to hurt them, not to do something dangerous, and certainly not to do something irresponsible. And once we go through the first visit, not only did we get things moving better, but we also built some trust, I think. And as a result, the following visits, they typically go much quicker, and usually we get a lot more done, a lot more effective after that. So to contrast, there are several chiropractic offices that require x-rays on every single patient. That in and of itself is not necessarily a bad thing. It doesn't necessarily go with the Choosing Wisely program, but sometimes people they feel more comfortable working on people if they know exactly what's going on inside and out. So you can't really knock people or chiropractors for wanting x-rays on everybody the first visit. Now we don't do that, but I don't knock the ones that do. But some will use those x-rays to convince patients there's something more going on and proceed to scare them into lots and lots of visits throughout the year when in reality, the patient's not having any real pain, and the research suggests a decrease in the curvature of the neck is pretty normal and does not typically have any huge impact on a patient as they age and go through their lifespan. So why do 80 visits in a year when ultimately 40 years from now, it's not going to be that big a deal anyways? So some chiropractors are notorious for this. Then many offices tend to perform several follow-up x-rays in an attempt to show some proof of effectiveness of their treatment. In Choosing Wisely guidelines, they are very firmly in opposition to this. They say no repeated x-rays. The radiation is not necessarily good for you, and certainly not doing it more than is absolutely necessary. So some offices will make you go to an educational class. Some will not work on you the first day and spread it out over a 2 or 3 day process before they finally get to start working on the patient, before the patient finally starts getting out of some pain instead of going to classes. Here at Creekstone, I feel that our new patients are here because they're in pain, and my goal is to get rid of it. Not tomorrow or the day after, not in 3 or 4 days after they've sat through a class and had a gob of x-rays. No. I want them better the day they walked into my clinic. That's not always the way it happens. Sometimes it's the 3rd or 4th visit. But my goal is that they get better the day they walk in here for the very first time. I want patients so excited by their visit and by their encounters with me and my staff that they leave impressed, excited, and ready to tell everyone they know all about this amazing new chiropractic office right here in Amarillo. We don't want to be our town's best kept secret. We want to create blabbermouths if we can. And basically, that's what you can expect on your first visit at Creekstone Integrated Care right here in Amarillo. Now, I hope that gives you some idea of how we treat patients and how we go about business. And I have to say that ethics, character, being smart and being responsible and being trustworthy, these are all qualities that are of utmost importance to me. That and fun and even love. If you've ever been here, you know we love our patients, and you know we love to have fun. So if you live in the Amarillo area and we can help you, give us a holler. Our website is www.creekstonecare.com, and our phone number is 806-355-3000. Until next week, I'm Dr. Jeff Williams. We'll see you then.